The 8 most common food allergies. Food allergies are very common. They affect about 6% of adults and 8% of children. One study suggests that nearly 11% of adults in the United States have a food allergy. Although it's possible for food to cause an allergic reaction, most food allergies are caused by 8 common food items. According to the FDA, these 8 items account for about 90% of all food allergy reactions in the country. This video is a detailed review of the 8 most common food allergies. It discusses their symptoms, who is at risk, what you can do about it. What is a food allergy? A food allergy is a condition in which certain foods trigger an abnormal immune response. It's caused by the body's immune system mistakenly recognizing certain proteins in food as harmful. When it triggers an allergic reaction, the body releases chemicals that trigger inflammation. Even small amounts of food can trigger an allergic reaction in people with food allergies. Food allergy symptoms. Symptoms can occur anywhere from a few minutes after exposure to a few hours or even a few days later, depending on the type of allergy. They may include some of the following: swelling of the tongue, mouth, or face, difficulty breathing, low blood pressure, vomiting, diarrhea, hives, itchy rash. Anaphylactic shock is a type of allergic reaction that can occur immediately following exposure to a food. Some people with this condition can experience a rapid onset of symptoms, such as a throat or tongue swelling. Many food intolerances are often mistaken for food allergies. Although food intolerances can severely affect one's quality of life, they are not considered life-threatening. Types of food allergies. True food allergies can be divided into 2 main types. Immunoglobulin E, IgA, mediated. In this type of food allergy, your body's immune system makes IgA antibodies that react with certain food. Antibodies are a type of blood protein used by your immune system to recognize and fight infection. An IgA-mediated allergic reaction usually occurs within several hours of eating the food allergen and can include mild to severe symptoms, including anaphylaxis. Non-IgA-mediated. In a non-IgA food allergy, your immune system does not make IgA antibodies, but other parts of the immune system are engaged in mounting a response against the perceived threat. A non-IgA-mediated allergic reaction often involves the skin or digestive symptoms, or a combination of those symptoms, including vomiting and diarrhea, and can occur up to 3 days after eating the food allergen. Here are the 8 most common food allergies. 1. Cow's milk. An allergy to cow's milk is most often seen in babies and young children. It's one of the most common childhood allergies, affecting 2 to 3% of babies and toddlers. Although it's very common in children, around 90% of them will outgrow it by the time they're 3 years old. Although there are different types of food allergies, the most common one is an IgA cow milk allergy. This condition can cause severe allergic reactions and can affect individuals with compromised immune systems. An allergic reaction usually occurs within 5 to 30 minutes after consuming cow's milk. People with this condition can experience various symptoms such as fever, vomiting, and hives. Non-IgA food allergies can also cause symptoms similar to those of an allergic reaction to cow's milk, such as nausea and vomiting. Although a non-IgA milk allergy can cause similar symptoms to an allergic reaction to cow's milk, it can be difficult to diagnose. If a diagnosis of a cow's milk allergy has been made, avoiding all types of food and drinks that contain the milk will be the only treatment. This includes any foods or drinks that contain milk, milk powder, cheese, butter, margarine, yogurt, cream, ice cream. Having a cow's milk allergy can affect the development of a child's immune system. As a result, breastfeeding mothers with this condition may have to avoid certain food and drink products. As for babies who are not breastfeeding, a healthcare professional will recommend a suitable alternative to a cow's milk-based formula. 2. Eggs. An egg allergy is the second most common cause of food allergy in children. However, 68% of children who are allergic to eggs will outgrow their allergy by the time they're 16 years old. Symptoms include digestive distress, such as a stomachache, skin reactions, such as hives or a rash. Respiratory problems. Anaphylaxis, which is rare. Although it's possible to have an allergic reaction to egg whites, it's not always the case. The proteins in egg yolks are slightly different from those in egg whites. Yet, most of the proteins that trigger an allergy are found in egg whites, so an egg white allergy is more common. Like other allergies, the treatment for an egg allergy is an egg-free diet. Although it's generally advised to avoid all egg-related products, there's a way to reduce the risk of allergic reactions by heating eggs. Doing so can alter the shape of the allergic proteins, which can help prevent them from causing a reaction. A study conducted by a university revealed that almost 70% of children with egg allergies could eat muffins that contain egg components. Some studies also suggest that introducing baking goods to children with egg allergies could help them get over their condition. However, the results of these studies are not yet clear. If you're allergic to eggs, then consuming them can cause severe reactions. Before you can reintroduce eggs to your diet, you should consult a healthcare professional. 3. Tree nuts. A tree nut allergy is an allergy to some of the nuts and seeds that come from trees. It's a common food allergy that affects around 1% to 3% of the U.S. population. It can also affect people from other countries. Some examples of tree nuts include Brazil nuts, almonds, cashews, pistachios, pine nuts, walnuts, macadamia nuts. People with a tree nut allergy will also be allergic to food products made with these nuts, such as nut butter and oils. They are advised to avoid all types of tree nuts, even if they're only allergic to one or two types. Since being allergic to a particular type of tree nut can increase one's chances of developing an allergic reaction to other tree nuts, avoiding all types of tree nuts is also advised. It's also easier to avoid tree nuts if one has a tree nut allergy. Unlike other allergies, this condition is usually lifelong. Allergies can also be very severe, and tree nut allergies are responsible for around 50% of anaphylaxis-related deaths. Since tree nut allergies can be life-threatening, people with these conditions are advised to carry an EpiPen at all times. An EpiPen is a life-saving device that can help people with severe allergic reactions. It can deliver a shot of epinephrine to help them breathe. Epinephrine, also known as adrenaline, is a hormone that's produced by the body when one's stressed. EpiPens can also help people with severe allergic reactions. They can be given as an injection to help reverse the effects of the allergic reaction. 4. Peanuts. As a tree nut allergy, peanut allergies are very common and can cause severe and potentially fatal allergic reactions. Although peanut and tree nut allergies are considered to be separate conditions, those with peanut allergies are still allergic to tree nuts. Although it's not known why people with peanut allergies develop this condition, it's believed that those with a family history of eating peanut products are most at risk. It was previously believed that introducing peanut products to a new child through a breastfeeding mother's diet could cause a peanut allergy. However, studies have since shown that introducing peanuts early may be protective. Peanut allergies affect around 1 to 3% of children and up to 2% of adults. However, around 15 to 22% of children who develop a peanut allergy will find it resolves as they move into their teenage years. Like other allergies, a peanut allergy is diagnosed using a combination of health history, skin prick testing, blood tests, food challenges. At the moment, the only effective treatment is avoidance of all peanuts and peanut-containing products. New treatment options are being developed for kids with peanut allergies. These include giving small amounts of peanut or peanut allergen powder under medical supervision. 5. Shellfish. Shellfish allergies are caused by the body's reaction to certain proteins found in the shells and eggs of certain types of fish. Examples of shellfish include shrimp, prawns, crayfish, lobster, squid, scallops. The most common protein that triggers an allergic reaction in people with seafood allergies is tropomyosin. Other proteins that can trigger this reaction include parvalbumin and arginine kinase. Symptoms of a shellfish allergy usually come on quickly and are similar to other EGA food allergies. However, a true seafood allergy can sometimes be hard to distinguish from an adverse reaction to a contaminant of seafood, such as bacteria, viruses, or parasites. Although the symptoms of a true seafood allergy are similar to those of other food allergies, they can also cause various health issues. Since a person with a shellfish allergy can't completely eliminate the condition over time, most people with it must avoid consuming all types of shellfish. Even though the vapors from cooking a shellfish can trigger an allergic reaction in people with a shellfish allergy, it's still important to avoid touching it when it's being prepared. 6. Wheat. A wheat allergy is an allergic response to one of the proteins found in wheat. It tends to affect children the most. Although, children with a wheat allergy often outgrow it by the time they reach 10 years old. Like other food allergies, a wheat allergy can cause various health issues, such as vomiting, abdominal pain, and rashes. It can also lead to severe reactions, such as anaphylactic shock. It's often confused with celiac disease and non-celiac gluten sensitivity, which can have similar digestive symptoms. A true wheat allergy can cause an allergic reaction to hundreds of proteins in wheat. This reaction can be life-threatening. Non-celiac gluten sensitivity and celiac disease are conditions that are caused by an abnormal reaction to a specific protein found in wheat. Although most people with celiac disease can successfully avoid gluten, it can still lead to fatal consequences. For people with non-celiac gluten sensitivity or celiac disease, avoiding wheat and other grains containing gluten is very important. Those with a wheat allergy only need to avoid wheat and can tolerate gluten from grains that do not contain wheat. A wheat allergy is often diagnosed through skin prick testing. Since avoiding wheat and other products is the only treatment for people with a wheat allergy, avoiding cosmetic and food products containing wheat is also important. 7. Soy. Soy allergies affect up to 0.5% of children and are most commonly seen in infants and children under 3 years old. The main cause of soy allergies is a protein found in soybeans or other food products. Although around 70% of children with these conditions eventually outgrow them, it's important to avoid soy products. The symptoms of a soy allergy can range from a runny nose and an itchy mouth to asthma attacks and breathing difficulties. A small number of babies who are allergic to cow's milk are also allergic to soy. Some of the common food triggers of a soy allergy include soy products, such as milk and soy sauce. It's important to read the labels of these products to avoid unknowingly exposing yourself to soy. Like other allergies, the only treatment for soy allergy is the avoidance of soy. 8. Fish. Fish allergies are common, affecting up to around 7% of adults. Similar to other allergies, people with fish allergies can develop them during childhood. However, it's not uncommon for them to develop a fish allergy later in life. Like a shellfish allergy, a fish allergy can cause a serious and potentially fatal allergic reaction. The main symptoms are vomiting and diarrhea, but, in rare cases, anaphylaxis can also occur. Since fish allergies can cause a serious allergic reaction, those with them are usually given an autoinjector to treat their condition. Although the symptoms of a fish allergy are similar to those of other allergic conditions, they can also be confused for reactions to fish toxins, bacteria, or viruses. Since fish and shellfish do not have the same proteins, people with fish allergies may not be allergic to them. However, many people with a fish allergy are allergic to one or more types of fish. Other foods. The 8 food allergies outlined are the most common ones. However, there are many more. Less common food allergies can also cause various symptoms, such as an allergic reaction to the mouth or lips. Some less common food allergies include linseed, sesame seed, peach, banana, avocado, kiwi fruit, passion fruit, celery, garlic, mustard seeds, aniseed, chamomile. Think you have a food allergy? Sometimes it can be difficult to tell the difference between food allergies and food intolerances. If you suspect you have a food allergy, it's important to speak with a doctor. To find out whether you have an allergy or intolerance, the doctor will likely order a number of diagnostic tests. These include dietary review. This is a detailed review of foods eaten, including timing and symptoms. Skin prick testing. For this test, a small amount of food is pricked into the skin using a tiny needle. The skin is then monitored for a reaction. Oral food challenges. For this test, the problem food is eaten in a controlled environment under medical supervision in gradually increasing amounts. Blood tests. In some circumstances, blood will be drawn, and the level of IgA antibodies is measured. Your doctor will also talk to you about how to manage your food allergies, and may also refer you to a dietitian for help. How to treat food allergies. Currently, food allergies cannot be cured. Scientists are working on new ways to help people with food allergies by desensitizing them to the allergens in their bodies. If you have an IgA-mediated or non-IgA-mediated food allergy, avoiding the foods that are allergic to you is the best way to prevent an allergic reaction. If you have a food allergy that's severe, your doctor may prescribe an epinephrine autoinjector to help keep you from accidentally consuming food that you're allergic to. These medications can also be used to carry around in case an allergic reaction occurs. These medications may include epinephrine. This medication helps reverse symptoms of a serious type of allergic reaction called anaphylaxis. Brand name epinephrine autoinjectors include EpiPen and Auvi-Q. Antihistamines. These medications can help reduce itching and congestion from less severe allergic reactions. Corticosteroids. These medications may be prescribed to reduce swelling from more severe allergic reactions. It's important to take all of the symptoms of food allergies seriously. Although some of these may be mild, they can still lead to an allergic reaction, which can be life-threatening. Non-IgA-mediated food allergies, which are less likely to cause anaphylaxis, can also have a negative impact on a person's quality of life. If you suspect that you have a food allergy, it's important to consult a doctor. They can then help determine which foods to avoid. Having a registered dietitian can help you avoid certain foods that are harmful to your health. They can also help you maintain a healthy diet and meet your nutrient needs. The bottom line: most food allergies are caused by 8 foods: cow's milk, eggs, tree nuts, peanuts, shellfish, fish, soy, and wheat. Food allergies are caused by the body's immune system mistakenly identifying certain food components as harmful. This can cause potentially life-threatening reactions. The only treatment is the removal of the food from your diet. If you suspect you have a food allergy, speak with a doctor about it.